Yeah, so I think we're going to get to what I think a lot of people are excited about this call, which is to feature some of the work that's going on right now in the downtown east side. So I'm really thankful to be able to introduce Wendy Peterson, who graciously accepted my invitation to, I guess, reflect back on what we've been trying to say about participatory practice in a very practical way. Sorry about that. So just to avoid stealing her thunder, I'll do a brief introduction of Wendy simply by saying that she directs the Downtown Eastside SRO Collaborative Society. SRO stands for Single Room Occupancy, which is a term that describes a particular form of historical housing in Vancouver and other parts of the country. And contingent, hold on, I'm going to advance the slide here. Here we go. The single occupancy, so a lot of folks will know about SROs through recent media articles that you can see in this slide. Just finally, Wendy is herself a longtime resident of the Downtown East Side. She's been working on many community-led research efforts, both in her current role as well as previous roles that I think she's going to talk about. And so as a way of turning the mic to you, Wendy, maybe just have us start by orienting us to the ground a little bit in terms of what the major issues that you're seeing in this place in the world today.
Okay, thanks, Jeff, and Jane, and everyone. Can people hear me okay? Oh, can you hear me?
I'm hearing you good, yeah.
Okay, good. So, hi, everybody. It's great to be here and to hear that opening about the chapter in that textbook. I'm not a community health professional. I'm a community organizer, and as Jeff said, I've lived and worked in the Downtown Eastside community, and I've been here since 1990, and I come from a small commercial fishing community on the west coast of BC originally. But I just want to switch the slide here. So we have a famous community center. This is a picture of it. It's at the intersection of Hastings and Main, which we call the living room of the Downtown East Side. In 2005, so I'm supposed to give you a little background about me and my community and our projects first. But in 2005, I was hired by the board of our community center to work with the Carnegie Community Action Project, and my job, which was outrageous but awesome and really difficult, and my job was to stop gentrification, get higher welfare rates, and more social housing for the community. So one of the things we did is we monitored the loss of housing in yearly reports and helped to get a new zoning plan for the area. We ended up getting the only no condominium zone in North America that we know of. And that's in only one little part of our community. But if you want to look up more about what the work that we did, you can look at the website for the Carnegie Community Action Project. And I see we've got a copy of one of the copies of the reports that we wrote. So we've always had a lot of drug users, especially opioid users, in the Downtown East Side. There used to be a healthy vacancy rate in our single room occupancy hotels. We have 5,000 of them. And drug users and others who are very vulnerable were never homeless here. But welfare rates were slashed in the 90s, and again by the provincial government, and then or by the federal government and then the provincial government. And poverty is way worse than when I first got to the Downtown East Side in the early 90s. So it's way worse now. And now rents in my community are way higher than what people in the single room occupancy hotels can afford. And basically now vulnerable tenants are being evicted because of speculation on the land. They're being kicked out for renovations and rent hikes. And private landlords are doubling and tripling the rents in hotels despite the downzoning that we won. It's not just low welfare rates and gentrification that's causing the housing crisis in my neighborhood. It's also the cancellation of the federal and provincial social housing programs. So overall, the mind frame of austerity and neoliberalism, where all our universal welfare, like the welfare state and the universal services, are downloaded now to community groups and private services, and things are not, we're not in good shape here. So out of that context, in 2015, we started this group called the Sro Collaborative, and our goal is to hold on to the remaining SRO stock in the community and get living conditions. So people are living in pretty bad conditions, and we want them improved so that we can improve the health of the tenants, my neighbors who are living in them. And we do this project by developing the leadership of peer advocates or tenants who live in the SROs. So we do a participatory approach, which I'm learning the theoretical basis of it from Jeff and others. But we have a participatory approach. So we are organizing with tenants in their hotels, and we're helping them make complaints to their landlords. So many tenants in our neighborhood are living with no heat, no hot water, mold, elevators that break down for extended periods of time, and even rats. I've actually seen rats in people's mattresses. I've seen the rats affecting seniors and people with addictions and mental illness and others who are just poor. It affects everybody, and it's not just rats, it's all the other horrible conditions that people live in. So when the fentanyl hit the downtown east side, people were also dying in these spaces at a high rate indoors, alone in their rooms. We ended up responding to that, but we also, with one project, which I'll tell you about in a minute, but our SRO Collaborative, we also had a campaign to take on the worst slumlord in the area in 2 of the hotels that they own. It was a 3-year campaign, and it was really, really tough for tenants to get involved in because they faced basically a lot of backlash, and they were on their own in terms of trying to make improvements without much backup from the system. So the main objective of the campaign was to get the city to enforce their own standards and maintenance bylaws. And eventually, because of our work, the city had to shut down the 2 hotels that we were working in, and the tenants were moved into nonprofit managed buildings, which was great. And the tenants now tell us that they're feeling healthier. And I was just at Tim Hortons last week, and I saw one of the tenants, and he said we saved his life because he's in such greater housing now. So if you want to learn more about that, you can Google Sahota, Regent, Balmoral. Those are 3 keywords you could Google to learn more about that campaign. But the main challenge for our group is lack of funding for this type of advocacy. So government tends to fund all kinds of social services, but they seem to be reluctant to fund the advocacy and the system changing work that we could be doing in order to fix the problems that are originating upstream. So as a result, the health of the people in our community is really, really bad. It's atrocious. And I want to talk a little bit more of the role of public health that I'm learning about in this regard in a second. But first, I want to say that our group, one of the projects that we ended up doing, we got a contract from the Public Health Authority to do a peer-focused community organizing project called the Toro Project, the Tenant Overdose Response Organizer Project. And it's a participatory health project for sure, I'm realizing now. The Toro, we get into the SROs, the single room occupancy hotels, and we train tenants or peers in the hotels to deliver OD response education and supplies to their neighbors. It's very much peer-led. It has a community organizing model, which means it focuses on building the leadership of peers in all aspects of the project. And public health has been amazingly supportive of this harm reduction project. And together we're working on saving lives. The downside of the program is it's mostly about delivering a health service, and we can't do advocacy and defend tenants from eviction or help make their housing conditions better through advocacy without risking this important program by getting kicked out by the landlord. So it's kind of complicated. So we are in this bind where we're training ourselves to not look at the other health related problems around us in order to deliver this one critical program. So we're frustrated by the level of poor health of people in our neighborhood and our community, and related especially to their housing conditions, which is what we really want to be tackling. So the SRO Collaborative, we're hoping that public health can get more involved in improving poor rental housing maintenance conditions and tackling the issue of poor housing supply. The health of people in my neighborhood is terrible. It's not only related to drug use, it's related to poverty and housing. And so I'm asking, how can public health workers help people be healthier here? I think one of the ways is to tackle the housing maintenance conditions and supplies, and the supply of that housing, to fund groups like ours to take a peer leadership approach to improving housing conditions through advocacy and community organizing, which is underfunded and undersupported. Get public health officers involved in monitoring housing conditions, and penalizing those who cannot maintain those standards. And public health could get more serious about advocating for more investment in social housing and other anti-poverty strategies, like raising welfare. The bigger upstream systemic policy changes that need to be made will have a great effect in improving people's health downstream. So we not just little projects to mitigate those effects, but get at a systemic fixes. So we need public health to advocate to get housing out of the market. The housing first model is not working. So we need to get more public housing, more social housing. So I'm not sure why public health can't do a lot of advocacy and work on those big systemic fixes, but I think it must be political, and land is political, and I think politicians are careful not to alienate private property owners and the rich who are not paying enough taxes, so we can all have a well-funded social housing program and a good safety net in Canada. So I wanted to say, just almost wrapping up here, I wanted to say something about the potential role for participatory practices in public health that would improve the people that I work with, their health and their lives. So I think if public health could get back into the business in our province in BC, I'm not sure what it's like in other provinces in Canada, but of regulating the private sector's housing maintenance and health conditions, that would be really great. This important responsibility was removed from the city when public health became part of the Vancouver Coastal Health, and that was in about the year 2000. And since then, enforcing healthy housing has been left to the city's permits and licensing department. So we really don't see a public health presence in the day-to-day challenges we face with dealing with bad landlords. More regulation of bad landlords is happening in the city of Vancouver around inspectors dealing with yards full of long grass than there are around housing conditions. So in general, city inspectors aren't trained and don't know or have the resources to keep up with the job of public health around maintenance conditions. They're not part of a public health team, and that would appreciate just how many ways that living in unsafe and exploitative housing can get in the way of people's health. So I wouldn't know necessarily about that gap in the public health system. I didn't realize that this was a gap from the public health perspective. If it weren't for the work that we do with the Right to Remain project. So we're doing this project with Jeff, our presenter, with his students from Queens, plus SRO tenants in our community. And it's been really great to work with researchers who have a public health perspective and who can help us trace some of the reasons why we're in the situation that we're in through our work with the archives and other research. And I think public health could spend more of their time with grassroots communities like ours, because I think it's probably an exchange. It's not just us getting information and being able to learn from public health researchers like Jeff, but we're also informing Jeff's work as well, and he's bringing that work out to other people across the country. And I wouldn't have partnered at all with an academic researcher if it weren't for Jeff being part of the community already. So I know Jeff because I've seen him do other projects in the community, and he's also with the Japanese Canadian community in the downtown east side. So it's a benefit for our community organizing project to be connected with a researcher who's part of the community, because it just helps strengthen what we learn, what we know. And I like to partner with people who I know are going to be here for the long term, because I feel like my time I want to invest in people who are going to be around for a long time, because it gives more benefit to my community in the long haul. If people are just coming and going, there's no advantage to us. So I'm really looking to invest my time and my group's time with people who are here for the long haul. It's never perfect. I think Jeff mentioned something about that. There are, like in our group, there are tensions around social mix with the Queen's researchers and the low-income researchers on our team, but we are in control of the project. I mean, we are, meaning the community group, the Sro Collaborative, and Jeff's really good at letting it be self-directed by our group, and he's mentoring his students in how to do that. So the project is really working to our benefit. So that's my reflections. I haven't had a chance before to reflect on how public health is involved in the downtown east side, other than as a recipient of that funding through the Toro Project that we're doing. And then also starting to realize that public health has been absent from the maintenance of buildings in our community. And I'm eager to learn more. So that's my presentation. And I don't know if people have more, if they have questions, or I'll leave it right here. Thank you.